everyone. My name is Hela and I'm a health educator with Access. And today we're going to be talking about mental health, especially when it relates to teenagers. And mental health is a very important topic that many teenagers and younger generations are now talking more about. And so when that's happening, it's very important that we have adults and parents and families begin to understand what mental health is. And that way they can have these better conversations with their children and then with their teenagers as well. Is the clicker?
You have to turn it on the left.
Oh, okay. That's okay. There you go. So when we're talking about mental health, many times it's confused for other things as well. So sometimes we'll use mental health and mental illness in the same kind of way, interchangeably. But however, there is a difference in between the two definitions, and it's better to get an understanding of what each one means. So that way we're able to better have these conversations and better know how to address them. So mental health is something we all have, and mental health is similar to our physical health. And our mental health also affects the way we're able to perform tasks mentally, regulate emotions, function, kind of focusing and speaking with others, relating to other people, also how we can handle stress, any kind of life changes, and also how we do our work and contribute to society and to our communities as well. And it's also how we feel and how we behave emotionally, psychologically, and then also socially with those around us. And then mental health is something that's always with us, and it can be either positive or it can be negative. And then mental health, again, does affect how we handle different things in life, like stress, change, any normal life events, how we can cope with these things, our resiliency as well. And then also how we feel about ourselves, how we feel about others, how we can relate to them, and then also the way we make our choices. So mental health really does affect the choices we make and how we make sense of different events. It also affects how we can communicate with others and also how we can form and keep relationships. And so just like physical health, someone can be physically healthy, they could be someone who has poor physical health. The same kind can happen with mental health. So we can be mentally healthy or we can have poor mental health. And when we're mentally healthy, this allows us to feel, to think, and to act in ways that allow us to enjoy life and to cope with life in a good way. But if we have poor mental health, it can result in us feeling unhappy, having a difficult time thinking, speaking, relating to other people. And we might also find ourselves feeling overwhelmed often and maybe becoming really stressed about certain situations. So it really affects the way we can cope with different situations and our resiliency as well. So then that leads to mental illness, which is under the term of mental health, mental wellness, mental health conditions. And mental illness specifically is referring to some sort of mental health condition that's going to affect the way we're thinking, the way we're behaving, and also the way we regulate our emotions. Or it can be a combination of all those. It's going to affect some aspect of the way we're mentally functioning. And if they are left untreated, mental illnesses can impact daily living. So this would be our ability, again, to work, to care for ourselves, for others, and then also to really relate and interact with other people. And then people with mental illness do often feel distressed most of the time. They may not feel like they're in control of certain aspects of their lives or of their lives altogether. And again, just like having any other medical condition, let's say diabetes or any heart conditions, there is no shame in that. We wouldn't really shame anyone who has a physical health condition or a physical health illness. So there really is no need to shame or to blame anyone for having a mental illness. It's the same kind of thing going on. And there is support, there is treatment that's available, and it's really something that we must begin to speak about and begin to treat in a way that it can be treated, that we shouldn't just rule someone out altogether and, say that they can't be helped or they can't be worked on or anything like that. And then we look at some of the different causes of mental illness, and we'll talk more about this later on, but many people might have these misconceptions about what causes mental illness. And so they might go to blaming the parent or blaming the child themselves or blaming the person themselves, and that's not the case at all. So it has nothing to do with the person or who they are or any kind of motivations they have. It really comes down to several different things. So we can't really pinpoint the exact cause of mental illness, but there are some different theories going around that there could be different things or different factors that would lead to a mental illness. So one would be genetics or heredity. And then that would be if it runs in a family, the mental illness, it can be passed down from parent to child in that kind of way. But this is not to say everyone with a mental illness will pass it down to their child or has gotten it through genetics, but that's one possibility. And then there's also biology. So some mental illnesses have been linked to neurotransmitters. And the neurotransmitters help the nerve cells in the brain communicate with one another, sending messages to our brain, to our bodies. And if there's something going on there, if they're not working properly, if these chemicals are out of balance, then that's where we can see some sort of symptoms begin to form. So that could lead to the symptoms of mental illness through that. And then also if someone has any brain defects or any brain injuries, especially to certain areas of the brain, they may also have this likelihood of experiencing a mental illness. And then there are a few other possible causes of mental illness, and then that would be anything related to psychological trauma. So some mental illnesses have been triggered by different kinds of trauma, especially neglect, severe emotional abuse, or physical abuse. And then if someone had an early important loss in their lives, maybe a parent or a loved one, that kind of trauma can also lead to the cause of a mental illness to form. And then there's also environmental stress. So any kind of stressful, traumatic events, those can also trigger a mental illness, especially for people who are more vulnerable or more likely to face a mental illness. So we know now some of the differences between mental illness and then what mental health is, and that everyone has mental health. We can be mentally healthy or have poor mental health, but then not everyone would have a mental illness per se. And then with mental illness and even with mental health topics, there's this stigma that goes around. And stigma is when we're treating someone else differently, we're isolating them, or we're trying to avoid them, maybe blaming them. And in this situation, that would be related to mental illness. So if someone has a mental illness, we would stigmatize them by treating them differently and maybe even blaming them for what they're experiencing. So when that happens, that really plays a large role in affecting the individual negatively. And that's because people will be reluctant to seek treatment, to speak up about what they're going through, maybe to even seek help, and then they become even more isolated. And so with stigma, there's the social stigma, so that's what the person would experience from others around them, from the society. And there's also the self-perceived stigma. So stigma can actually lead to the person to begin to stigmatize their own selves. So they may begin to view themselves in a negative way, they might begin to judge themselves, really hate these aspects of themselves, and then that would also lead to worsening symptoms for them. So stigma is never a good thing, and it really causes a lot of barriers for the person, especially in relation to mental illness. And then these are some other effects of stigma, especially with those with a mental illness. And again, like I mentioned before, it would lead to a reluctance to seek out treatment. And if a person ends up going to treatment, they might delay it so long because they were afraid to open up. Maybe they were in denial, or a family member was in denial. So they never really wanted to open up and then get the treatment that they needed. And then they may also face social rejection, isolation, might avoid people, anything in relation to that. And then it's also going to lead to worse psychological well-being. They might be misunderstood among family, among friends. They might be victims of violence, harassment, maybe bullying. And then overall, it's going to lead to a poor quality of life, and they might begin to feel more shame and then self-doubt as well. So the main takeaway from this is that stigma can really make it difficult for people to seek treatment, especially treatment that could potentially save their lives. And then we do hear a lot of these reasons going around that people might blame a teenager for having a mental illness. They might blame a person for having a mental illness. And then they might also blame the family or the parents or even friends. And it's really important to understand that mental illness is not any of these things. It's not the parent's fault, it's not the child's fault, it's not the individual's fault at all. And it isn't really a sign of any bad parenting, or that the teenager's a bad child, or that they're lazy, or even that they're faking it for attention. None of those reasons would lead to a mental illness. And it also doesn't mean that the person is now violent, dangerous, they must be avoided. And it also doesn't mean that they cannot get better from this, that they cannot manage it and cope with it. And it also doesn't mean that there's now shame or embarrassment being brought onto the family and to the teenager themselves. So it's really important to understand that mental illness is caused by many of the different things we mentioned earlier, but it's not caused by any of these over here. So we'll look at just a few examples of mental health conditions, especially the ones that are popular among teenagers. And these are some of the common mental illnesses that we might hear teenagers speak to parents about or open up about, or they might be speaking about it to others. And again, just a mental illness is anything that's going to, or a mental health condition that's going to affect the way the person's thinking, the way they're feeling, maybe their behavior, and then also a combination of all these things, because we know that the way we think is directly going to be affecting the way we feel, and then also our behavior. So we act in that kind of way. And then these are some of the different types of mental illness. This is not a whole list of mental illness, but it's the most common ones, especially among teenagers. And it involves anxiety disorders, there might be depressive disorders, there might be bipolar disorders, obsessive compulsive disorders, and then also sleep-wake disorders and eating disorders as well. And then these are some of the most common ones that might be present among children and teenagers. These are the 3 mental health conditions that I'll be going over today, again, because teenagers might be experiencing these most often, or they might speak about them more often. So it's really helpful for parents to have an understanding of what they are, and then they can help their teenager in dealing with it and coping with it, and then knowing what kind of signs to look out for. So that way they can have that conversation with their child, and then hopefully get them to the treatment and services that they need. So there's generalized anxiety, and this is when the person is excessively worrying about everyday matters. So it's not just one situation or one thing that's worrying them, but it's generally many different things. And sometimes they have trouble pinpointing what it is that's worrying them. There are also social phobias, and then this would be having severe feelings of self-consciousness and then also insecurity in relation to social settings. Sometimes the person might be even afraid of the thought to potentially speak to other people. So just thinking about socializing might lead to feelings of anxiety. And then there's also depression, and this would include persistent feelings of anxiety, emptiness, sadness, and then I'll also go into a bit more detail of these different mental health conditions. So with the symptoms of generalized anxiety disorder, this isn't a full list, but it's some of the most common symptoms, especially ones to look out for, maybe in a teenager, in a child, or a family member, to see if they might be facing any of these symptoms, and then again, to know how to help them further. So it could include feeling restless, maybe feeling fatigued most of the time, struggling to concentrate, they might seem on edge, and then they may also seem more irritable, maybe have muscle tension, or they seem really tense. And then they may struggle to also keep their worries under control. So they might come up to you with many different worries, and then you don't really know how to help them with that or what to really start with. So it might just be worrying about many things most of the time. And then they may also struggle with sleeping. They might have a hard time sleeping, staying asleep, or even not feeling well rested when they do sleep. With social anxiety disorders, these are some of the symptoms to look out for that, a mental health condition. And the person, again, might feel overly anxious just at the thought of being around other people. They might struggle to speak to other people. And then they may have self-consciousness, again, humiliation as something that they really fear. And then they also might fear being embarrassed. They might not want to do certain things with that potential of being embarrassed by others. And then also they do fear rejection and then offending other people as well. And then the main thing that also guides or really keeps that anxiety going would be that worry about being judged, being rejected from others. And then they might also tend to avoid people, avoid other places, especially if they know they have to socialize there, or if they're going to be that center of attention. And then they may also experience physical symptoms. There might be sweating, blushing, they might tremble around others, and then they may also struggle to keep friends, to make new friends, and also, again, maybe thinking about plans weeks ahead of time that they made, and then really feeling dread or anxiety about these events, even if they're not happening anytime soon. So this is all in relation to socializing and then relationships with other people. And then with depressive disorders, these are some of the different signs to be looking out for in a teenager or in a family member. And these would be persistently feeling sad, empty. They might complain to you that they're feeling empty. They don't really feel much of anything. They might have hopelessness or any kind of pessimism going on. And then they might struggle again to be a bit irritable. They might be bothered easily. having a difficult time socializing much, not having a lot of that energy to do daily tasks or to even speak to other people. And then their movement, maybe they're feeling a bit restless. They might struggle to memorize things, to remember anything, being often forgetful. Decision making becomes difficult. And then there might also be the last three are some of the most common signs of depressive disorders. And then that would be sudden changes in appearance, especially with their weight, appetite, and then also struggling to sleep well, staying asleep, waking up, not really feeling too well rested. And then they might also complain of different kinds of aches or pains that really don't seem to be going away even when they're treated or being addressed. And then also if they are losing interest in any hobbies or things that they did once enjoy, so any kind of activities, you notice that they're not attending a lot of after-school events that they normally would have, or any kind of major change in behavior that is uncommon to them. And then with all these different symptoms of the different mental health conditions, it's not to say that if a teenager has some of these that they automatically have a mental health illness or a mental health diagnosis, but it's something to keep an eye out for. It's something to look out for just to see what is going on. There might be something else going on that they might need addressed, or they could have some sort of mental health illness that needs to be addressed as well. So not to make any assumptions right away if the teenager isn't sleeping well, that could just be as a result of something else, but it's always important to see any kind of sudden changes or major changes as a sign for you to take the next step, just to speak to them, and then to hear what's going on with them. And then for the next few slides, we'll look over how a parent can help their teenager in dealing with any kind of mental illness or mental health condition. So mental illnesses, most of the time, can be prevented early on. Some of them cannot, but for the most part, there are many mental illnesses that can be prevented, especially if treatment is sought out early on. But the issue is, again, with stigma, many parents, many people might avoid going to seek help or to ask for help or to take their child to a doctor or a mental health professional. And then that's because of that denial. Many parents think this can't be happening to my child or this couldn't be happening to me. And that is really due to that stigma, that reluctance to speak about mental health illnesses and mental health conditions. And when we begin by reducing that stigma, reducing the stereotypes, not giving in to those stereotypes that people have about mental illness, that's a really great first step in getting the person help, getting the teenager help as well. And for these few slides here, we'll look at how to address the symptoms before they get worse. So to help a teenager before the symptoms of a mental illness get worse for them, and a good step to take would be to speak to the teenager if you are concerned. And if your teenager seems stressed or if there has been a significant change in their behavior, to take that first step to speak with them. That is great to address it in a casual conversation, avoiding any accusations or anything like that. And again, it might not mean that they need a psychiatric diagnosis, they might not have depression or anxiety disorders, but it could be a sign that there is something going on. Maybe they're struggling to deal with stress or any kind of friendship issues that they have, and they could really use your help with that. Again, looking at a few more ways to address the symptoms before they get worse, so before the mental illness begins to worsen or the symptoms begin to worsen. You can also check in with your teenager by simply asking them how they're feeling, how are things going on in their life, and then just hearing more about what they experience, what they go through, and what's their day-to-day life look like. But when you're speaking to them, it's important to look at any changes in behavior. How are they speaking to you? What kind of words are they using? And to avoid speaking over them, to do a lot more listening than you do speaking, and not to jump to any kind of conclusions, but to encourage your teenager, encourage your child to keep talking to you. And then also to validate their feelings as well. So once you do that, you can also encourage your teenager to listen to what they're feeling, to label any emotions that they have going on, to learn how to accept any emotions and then to work through them. So not telling them just to stop worrying or to tell them to cheer up. Words like that are dismissive and they don't really get the child feeling validated or feeling helped. And if anything, it's going to maybe push them away even more because they're going to be really reluctant or hesitant to speak to you about it again, let alone to get help from a professional or someone who could help them if symptoms do worsen. And then also allowing your teenager to think of different ways they can cope with their emotions, with life stressors, encouraging healthy coping skills, healthy emotional regulation skills, and then allowing them to get that help from you as well. So you can give them good advice on how they can handle different stressors, maybe things that you do that help you manage emotions. And then they're more likely to pick up on healthy behaviors, healthy habits from you and from family members, especially if it's something that they see going on around them a lot. And so sometimes we don't get the teenager or the person the help they need early on, and unfortunately sometimes the symptoms end up becoming worse, and we end up realizing we do need to help our teenagers or help our family members. And a good way is to now educate yourself about what mental illness is, what mental health conditions are, and then to begin speaking openly about them. And that way we begin to reduce the stigma, and then we make it feel like it's okay for the teenager to open up to you, to speak to you about what they're going through, and they won't really be feeling any kind of shame as much as they would have if, the family is one that judges others with mental illness or doesn't speak about mental illness. And then to also know and watch out for the warning signs, maybe some of the ones that we spoke about today, and then also to ask a mental health professional or to look online at credible websites to see what are some common warning signs. And then if you see those in your teenager, you know to take that next step to speak to them, and then after that maybe seek help from a professional, especially a doctor or a mental health professional. And many of the times people might jump to conclusions, so they might blame the teenager, they might blame it on the phone or on their friends or social media, and they'll tell them that it's all those things' faults that they have a mental illness. However, we know the different causes, we know it's no one's fault for that. And using those kinds of words or blaming certain people or certain situations, again, is dismissive, it's judgmental, and it does more harm than it does good. And then also to reassure your teen that they're not the only one who deals with these issues. Sometimes they might feel that they're alone in this, that no one else is possibly experiencing what they're experiencing, and that could really lead them to feel isolated. So it's all about letting them feel loved, feel understood, and to know that they're not alone in this, and that you're on their side through it all to help them. Or else they end up trying to deal with it on their own, and oftentimes people fail to get anywhere with that. And then of course, a very important thing to do is to consult with a primary care doctor or to speak to a mental health professional further, so you can do the first steps to speak with your teenager, let them feel understood, feel heard, feel protected, but of course it should also be handled by a professional if needed, if symptoms are worsening, or if you feel like you don't know what to do next. And then there are also many affordable options in the community, many affordable options nearby, and then the next slide should have many different services that are around. So with access, we do have behavioral health programs, and then the address is over here. This is the location in Dearborn, Michigan. And then we also have specific mental health programs for adults. We also have specific ones for children, for teenagers. This would be for those aged 16 to 17. And then we also have other centers for anyone who might need behavioral health services or mental health services. And then these are affordable, they're available in the community, and they do serve Dearborn and Dearborn Heights as well. And then for educational resources, these would help you in getting that conversation started with your teenager, especially if you're noticing those different signs or symptoms of mental illness. So there's the National Alliance on Mental Illness, and then they offer many great online resources, videos, discussion boards, or groups where you can hear from other people maybe experiencing similar things to you. And then you can also learn on that website different ways for you to educate yourself on the signs and symptoms, how to have good conversations with your teenager. And then a great website would also be makeitokay.org. And this provides you with tips about mental illness and how to speak to someone or a loved one about these issues. And we also have different helplines, and then these are available on the slides as well. And that is all for today. Thank you.